Well, good morning, NeoMed community. Thank you again for joining me on this Monday to allow me to give you updates and then to open it up for questions and answers. There are 4 specific topics I wanted to make sure I covered in detail with you today. First, many of you will note that this morning we sent out the return to campus plan, specifically the return to work plan, and how we'll be managing sequencing, bringing back our faculty, our staff, and then our students in a sequential phase, ensuring first and foremost that your health and that your safety are number one to us. That has to be our priority. I again want to thank Dr. Joe Zarconi and his team that created this plan for us to ensure that we were following medically prudent and scientifically prudent advice, that we were aligned with the Center for Disease Control and the government, and that we were also following the recommendations of the Inter-University Council, a group that had brought together experts from each of the universities to put together a document that helped us to move forward in a safe and effective way. An email went out today giving you the executive summary on that, and it will take you to links where you can read in detail what our plans are. As you walk onto our campus, you will note that there is signage up indicating that specific rooms are limited to very few people. It will note on the outside of the door how many can be in each room. There's signage up about face coverings, social distancing, hand hygiene, symptom reporting, and all of us will be required to follow this in our new normal state as we come back to this campus to support our mission of education, research, and service. Our first-year medical students will be coming onto campus approximately the 2nd to 3rd week of July, so we are not very far out from being ready to run our organization at full force. Our College of Pharmacy students will join shortly after. Over the summer, we'll have faculty on campus completing critical research, and we'll be bringing our summer research scholars on to get their research experiences. It's been difficult adapting to the COVID-19 restrictions, but as we've worked hard and we have flattened that curve, we are now ready to come back and do so in a safe manner with more data to support our measures and how we can continue to move forward safely. Just please understand that what we've documented now will likely change over time as we continue to learn more and as we watch the experiment across the US and across the world unfold and start to better understand the consequences of the return to normal activities that have been implemented nationwide and worldwide. We will continue to monitor and act for your safety and for your health. The details of the plan explicitly lay out how we will go about phasing our team back into place. Part of that phasing in will be based on employees' necessity for being here to perform critical tasks for opening up research more broadly, for teaching our students, and for providing support services to our students and to our staff. We're also working to take into account the impact that this has on those who are in at-risk populations or who live with at-risk populations, and the impact from those who may be in a position where they do not have the ability to provide alternate support to family members. Fortunately, the governor of the state has now fairly broadly opened up daycare facilities, of course, following strict restrictions on how they're going to maintain safety for the health and security of those young children. And we have opened up the ability to now run most every aspect of our business infrastructure to support all of you, including, as I mentioned before, one-on-one services with close contact with the mandate that we wear face coverings, hand hygiene, and do our best when possible to social distance. NeoMed will be moving into this realm. We are working very closely with our other universities across the state, and I feel very confident that the work led by Dr. Joe Zarconi here is going to allow us to do so in a very safe manner. Next, we need to talk a little bit about the progressive understanding of our budget. As I'd mentioned over the last several weeks, we are taking large cuts to our revenues that come from the state. We expect some cuts to come our way from reduced enrollment, potentially in the College of Graduate Studies, as the economy and its downturn has had substantial impact on the ability of some students to be able to come to campus, while others are weighing whether they should take a gap year this year and then return in a future year at our university. These, along with our reduced services that we'll be offering in order to follow state guidelines, such as grab and go only for the bistro, reductions in operating times for some of our support services, the way we manage our bookstore, and the way we reduce the number of people who can be present due to social distancing will all have an impact on the normal revenues generated at the university. I really want to thank all of you, as well as the management team here at the university, for coming together to figure out ways to reduce our costs that have as limited an impact as possible on our faculty and our staff, while ensuring high quality programs for our students, and also coming together to bear a small amount of the total losses that we'll be experiencing through limited measures that will have an impact on all of us. But again, I'm stating that for now, we are not planning any large layoffs. We're not planning any large-scale furloughs or any substantial salary cuts. At this time, as I mentioned before, we will not be able to provide for salary increases or for bonuses. However, we are meeting with our Board of Trustees on Wednesday. I've been engaging with them closely. That incredible group who worked so hard to support the strategy of this university and to ensure that our implementation of policies and measures are in the best interest of the state, our faculty, our staff, and our students. What I've asked is the ability to not have a one and done budget this year, but to assume we'll take a large cut from the state. And if that large cut is not as large as we thought it would be, that we can come back and look at ways to reward our hardworking team here at NeoMed for the financially for the great work that they do that is so well deserved. So please understand, this is not intended to be an action that will last for the whole year. We just need to better understand what our finances will look like as this year comes forward. All of us are truly hoping we don't experience a second surge. If that happens, then all bets are off, and we'll have to reset what we're doing and figure out how to deal with catastrophic loss, as well as how to reposition ourselves from an education and a research standpoint. We've done a great job pivoting as an organization so far, and I'm convinced we'll continue to do that and to do that well. I made a comment in our last meeting when I was asked about our faculty who are newly promoted. I'm going to be working with those faculty very closely over the course of this next week, along with the deans and the chairs of those departments. We did make a specific decision not to delay their promotions. They're well earned. They're part of what they had as a commitment from this university. And what we'll look at doing is how we can go about ensuring that they are financially on par with their peers. Because as I said, we are not here to reduce salaries at this time. What we are trying not to do to stay fiscally prudent is not to be able to increase salaries. As I reevaluated this comment that I made last time, I realized that these individuals had earned the positions that they have now been given or will be given by the Board of Trustees on Wednesday, and bringing them up to a salary structure in close comparison to their peer group is not really an increase. It is simply putting them to where they should be for the hard work and effort they've had at this university. So I will meet with them specifically and go back and have an opportunity to figure out how we can do this in a fiscally responsible manner. I'm again thanking every one of you for your great hard work on allowing us to be able to do this. Most of what we are doing are not going to, those cuts will not be painful. We are working to take those at the university level, at a national organizational level, in a way that's not really going to affect our standard operations around our key mission. We understand the importance of supporting you, our faculty, and our staff, and of course, all of us supporting our students and ensuring they have an exceptional student experience here at Northeast Ohio Medical University. I'll have more to share with you after our board meeting on Wednesday. It's a critical meeting for us this year because in June, this is when the board approves our budget or will request that we revise our budget. I feel like we're in a pretty good place, especially compared to other organizations around the state. And we'll give you an update next week on what's transpired during that meeting. There are things that are continuing to move forward at this university that are critical to our long-term sustainability and meet our critical mission requirements. I want to thank the researchers who've come back to campus in a very safe and judicious manner. We've been monitoring, everyone is following the social distancing guidelines and ensuring that we keep our campus safe. And we'll continue to work closely with the Department of Health as we start to evolve and change these policies and procedures that are in place to ensure that we are continuing to maintain a safe facility. I also want to thank the College of Pharmacy and the College of Medicine and the College of Graduate Studies for being able to continue to ensure that our students can come back to a safe and productive educational environment. Our medical school has now taken about 2/3 of our clinical year students and introduced them back into the hospital settings. As of today, we are expecting the rest of them to be in place by June 15th. This was not an easy task, and I want to thank that team for allowing that to happen, and for the College of Pharmacy, who's continued to have their students getting their clinical experiences all this time. When we talk about security and safety and risk mitigation on our campus, it's even more paramount that we do this for the students who are on the front lines in the clinical setting, where we know patients who are COVID positive are presenting. So all of us are taking on risk, and this is a little bit more risky venture than it is being here on our campus. We are doing absolutely everything we can with our health system partners to mitigate that risk and ensure the safety of our students. So thank you to everybody for allowing this to take place and to getting us back into what we do, creating the healthcare providers for this state and for this nation. My third topic is a little bit more solemn, and it's one that we have a social responsibility to ensure that we have an opportunity to address as a university. All of you have watched as we've seen the anger, the frustration, and the fear unfold across this nation over the last week. The name George Floyd should ring a bell with all of you. His is a name that's been added with so many others, such as Ahmaud Arbery, Breonna Taylor, Michael Brown, and so many others over the years, due to social injustices and system-based racism that exists within our nation. It is unacceptable, and it cannot be tolerated. NeoMed is a leader in promoting diversity and recognizing that we as a human race are made up of a diverse group of people from across this country and across this world. None of us, no two of us are the same. Even identical genetic twins have variations. The things that make us different, our hair color, our skin color, the way we think, our religious beliefs. So many other things define who we are as individuals, and they're unique to us. All of those variations need to be celebrated. It makes us who we are as a human race, as a group of individuals who come together to be better than any one of us can be alone. Unfortunately, Many within our society use these unique and value differences in who we are to denigrate, to demoralize, and to demean. I'm asking all of you to stand up against this systemic oppression and to do so in a productive way. Let's not become evil fighting evil. Violence is not our way to make change. Every one of us has an obligation to stand up for our fellow citizens. And this has been a particularly difficult time on Neomed's Black community, our students, our staff, our faculty, our patients, and all of those in the community that support us. It is time for all of us to stand up in lockstep, arm in arm, and to fight this systematic racism and oppression that exists. I know there are those out there who say, I don't see it. Day-to-day life seems fine, and periodically something happens that brings our attention to it. And that's just because you're oblivious to it. You're not seeing it because it does not affect you. It's the same argument to say hunger is not a problem when you have a job that allows you to buy groceries, or homelessness is not a problem when you have a home and a family. Well, racism is a problem. And if you're not noticing it because you're not experiencing it, then you're not paying attention to it. And then by default, you are part of the problem. I'm asking all of you to stand up and to fight these inequities, to fight these social injustices, to stand up for your fellow Neomed employees and your fellow man. It is our obligation to do so. We are a healthcare university. Healthcare knows no discrimination. It knows no boundaries. We treat everybody equally and the same, and we benefit from that diversity. And our job is to eliminate and to eradicate racism and discrimination at any time. What all of us may be failing to see is that this is not an isolated moment. We've watched as white supremacy movements have increased worldwide. We've watched as anti-Semitism has increased worldwide. And we have watched while racism has flourished in this country, often hidden, but always present. Later today, the university will be releasing our statement, our communication on our position relative to these events. This is something that we would have loved to have had out sooner, but we've taken the time working with our communications team to draft something that we wanted to ensure was going to be thoughtful, impactful, and supportive for our community. Let's not waste this moment. Let's not let the name George Floyd become another name that's forgotten until another one comes into play and all of us go up in arms again and become upset. Let's not waste this moment to make change and to look after our fellow citizen, our fellow man. We are all related, we are all different, and we need to celebrate that. So please continue to advocate and support peacefully and strongly. Let your word be heard with your fellow citizens and with your legislature. Let's ensure change is implemented, and let us never forget. Neomed is about compassionate care, equitable care, and just care. Social justice is at the root of who we are, and we have programs that focus on this, as well as rural and urban healthcare, recognizing the differences and embracing the differences in our community. I'm going to end with that somber note and ask all of you to please stand up and to fight. in a non-violent and productive manner. I'm now going to open it up to questions.
At this time, can you explain why the state continues to cut funding to higher education?
I can. So higher education is one of a few areas that the state actually places priority funding into. One is going to be ensuring workforce development and supporting unemployment. Another is going to be Center for Medicaid and Medicaid Care Services, specifically Medicaid. And as this economic downturn has hit us, unemployment has skyrocketed, and the number of individuals in our society who are going to need Medicaid benefits will also be skyrocketing. There are only so many places they can find to take dollars from, and one of those is going to be higher education. And it's not just higher education. We've watched the cuts occur at education at all levels, because this is one of the other big areas where funding takes place. So we know the cuts are coming. They've been judicious about this, and they understand the important role that higher education has in producing healthcare providers and producing scientists to help us overcome COVID and other pandemics like this that will come our way in the future, and for economic development. If we shut down higher education, we will lose the capable workforce to other states that are standing up to ensure that they are producing capable members to grow their economies and their societies. So they're very cognizant of this, and they're doing what they can to keep those limited. But we have a requirement for a balanced budget in the state, and they've got to figure out ways to balance it. And one of those is going to be in higher education. And I'll tell you, they're right in many ways. We need to do a better job in managing our organizations, just like healthcare does. If you look at the two industries in the US that have outpaced the economy dramatically in costs, it's higher education and it's healthcare. So we will be more fiscally responsible. This is part of our lean initiative here at the university, so that we can do more with less, that we are not being wasteful with taxpayer dollars, but at the same time, the state is doing what they can to support us also.
Is there, or can there be a way to record savings of expenses that each department is creating from canceling or retooling services of events?
We are collecting that information. I've asked Mary Taylor's team to do specifically that. Part of the reason for this last fiscal year is we set a budget, and that budget is not going to be what we thought it was. We've already taken about an $880,000 reduction from the state. Auxiliary services, which are stood up to support our faculty, our staff, and especially our students, have been shut down because we don't have people on campus to use the coffee shop, to use the bistro, to use the bookstore. And those normally generate revenue and have expenses. And right now we are having expenses, but we aren't having revenue. When you add total costs in, we're predicting about a $2.5 million loss this year. And so the reductions that we've had in expenditures this year on events, on travel, on pieces that we normally would have spent more money on, even around research that are not funded by outside grants, those savings will come back to the university to cover the losses that we've taken, because that money was actually never there. So we are tracking it.
There are no further questions, but I would like to share a summarization of some of the comments by the NeoMed community. Thank you, President Langell, for speaking out on the important topic of racism. Our diversity has always been one of the favorite things about NeoMed. Of all forms of inequality, and injustice in healthcare is the most shocking and inhumane. Thank you for your compassionate and accurate comments. I appreciate this so very much and love everybody on this campus, and thank you for speaking out. Such wonderful leadership that NeoMed is happy to have and lucky to have. I'm proud to work at NeoMed. Thank you, Dr. Langell, for your compassionate messages.
Well, a big thank you to our community. We know that our community is not the problem, but we need to be the solution. We need to be the leaders at every level. Stand up, fight for the rights of everyone cherish and embrace diversity. It makes us so much more than who we could be without it. I ask all of you to be safe and to be advocates. And I look forward to seeing all of you again next Monday for an update, when I'll brief you on further developments and information regarding our board meeting. Have a wonderful and safe day.